So, angioplasty or CABG, that's the greatest question and the most difficult question that every patient struggles with. And in fact, a lot of doctors struggle with that question. And we also go through that in detail. And it is a very difficult question to answer. But if you look at it broadly, what is it? Do you have to undergo surgery for this, or do you have to undergo angioplasty for this? 10 years back, the answer was very easy, because very severe disease, multiple blocks, few 100% blocks, it's surgery, and simpler lesions, angioplasty. But today, angioplasty has evolved to a point where almost everybody can have angioplasty. It just depends on the skill of the doctor, the amount of technology available at that hospital, and of course, some expenses. Once these three things are met, almost anybody can undergo angioplasty for almost any kind of disease. So this is a revolution by itself. So why do people get so confused about whether to choose surgery or whether to choose angioplasty? Because there is a deep-rooted belief that surgery is a long-term thing and angioplasty is not such a long-term thing. Now, this belief has evolved over time from the 60s to 70s and is no longer true. People mindset has not evolved with the time, with the science. And I still believe that there are some people in the medical profession who still have not grown up to that data. Right? We as interventional cardiologists and me as an aggressive CTO operator strongly believe that everybody should be given an opportunity at angioplasty, because it is a very simple procedure. When it comes to pain, there is no pain. Nobody's chest is opened, there is no scar. It's a very simple procedure as far as the patient is concerned. For us, it is almost the same level of complexity, doing a bypass surgery and doing an angioplasty. Now, Japan leads the way when you look at angioplasty. Why? Because the Japanese have a belief that if you open the chest, the soul departs. So people really don't want their chest to be opened by any surgeon for any reason, not just bypass surgery. So people resist bypass surgery a lot. So Japanese cardiologists have evolved to do angioplasty, even the most difficult segments. And as you know, Japanese are meticulous with everything, and they have all the material required to do angioplasty. And we are very close to the Japanese in terms of technology transfer and learning. So they are always a few months ahead of us, but we regularly learn from them, and we go there for workshops, and our technology is, I would say, just a few months behind. And because of this belief in Japan, they have evolved to such a point, but we don't have that belief. But more and more people are getting aware that surgery is no longer the only option. There are options other than surgery, and angioplasty is an excellent option. There is no longer this big divide that, this can go only for surgery, this can go only for angioplasty. No. Almost anybody can undergo angioplasty at this point of time. And that is why I strongly believe that angioplasty is for all, unless it is impossible to do, which is a very, very, very small segment.